أهلا بكم في تلفزيون CardioAlex. And with us now, Dr. Grace Lin, Professor of Cardiology from the USA. Hello, Doctor. How are you?
Good. How are you?
Welcome. What do you think about CardioAlex 2017, and is it meeting your expectation?
Oh, I think it's a great meeting. I think it's very well organized, and I understand there are over 6,000 attendees. So it's a fantastic meeting. I'm very, very much enjoying it.
Okay. What are you going to present this year?
So I had a couple of talks this year. So I'm talking about advanced heart failure and how to identify patients who need advanced heart failure therapy, such as transplant and LVAD. I'm talking about cardiotoxicities of cancer therapy, so chemotherapy-related cardiotoxicities, and I'm also talking about cardiac amyloidosis and the new treatments that we have available.
Okay. What is the frequency of heart failure with preserved ejection fraction you encounter in your practice?
I would say it's about half of the patients that we see. We actually have, at Mayo Clinic where I work, a specific clinic that's aimed at these patients, so we perhaps see a little bit more than our share, but generally it's about half of the patients that we see.
Okay. Why they are still underrepresented in randomized controlled trials?
I think that's an interesting question. I don't think it's so much that they're underrepresented, but that in the trials for patients with heart failure with preserved ejection fraction, they use a number of different criteria. So I think it's maybe needing a trial that's more directed just at these patients, and of course there are some trials underway now.
Okay. Do you think the indications of CRT will be expanded, given that the European guidelines mention class I identification of a complex more than 130 ms in LBB morphology, while the American guidelines will still state 150 as class I?
So the reason the American guidelines downgraded the patients that were less than 150 is because the Made It CRT trial suggested those patients are the ones that did the best. So I think that probably they'll stick with that as the cutoff, although in practice sometimes we are placing the devices in these patients because, as you say, the ESE guidelines say that 130 milliseconds is an appropriate cutoff, and actually the American guidelines still give a lower class recommendation, so we still do place it in those patients.
Okay. At the end, we would like you to say a word to the people all around the world to come to visit Egypt, and that Egypt is safe, and about your experience here.
Oh, I've had a wonderful experience here in Egypt. I went to see the pyramids yesterday, and the meeting is fantastic, and I've had a great time, and hope everyone comes to visit.
Okay. Thanks a lot, Doctor. Thank you.
Thank you.
Have a nice day.